Hello everyone, my name is Cary Lacefield, and of course I'd like you to know some things about myself foundationally. I'm a board-certified family practice osteopathic physician in Harrah, Oklahoma, where I've practiced since 1983. In 2006, we added to the Family Care Center of Harrah a lifestyle program called LOL, Lifestyle Choices for Optimal Living. Since that time, we've continued to grow the lifestyle initiative in our practice by incorporating it into our traditional family practice, as well as growing the wellness component. 2 years ago, I learned about DioVasc while attending a conference. My mind quickly went towards several cases, 3 of which were particularly severe and difficult. I found myself walking closely beside 3 people whose medical histories were complicated by chronic obstructive lung disease, and they also battled frequent lower extremity venous stasis ulcers as well as small vessel disease. The ulcers occurred 2 to 3 times per year and usually required 4 to 6 weeks for a complete resolve. One of the cases was a woman who had severe peripheral arterial disease and continued to smoke. She'd been in my practice for years, she was a registered nurse, and obviously she was in a tough battle with a severe addiction. She had served many patients with her entire being during her career, and I wanted to serve her in the same way. She'd been told by many practitioners that she would likely lose her legs. When I heard about DioVasc, I added it to the regimen that we had in place. Although she passed on about a year after adding DioVasc, she passed with both legs and her dignity. After all these years of practice, that particular journey was one of the most rewarding. From there, I've also seen great success in many ladies that have desired to reduce the appearance of spider veins and have seen some positive effects in people who have driving and sitting jobs that suffer from hemorrhoids. DioVasc is a dietary supplement that contains citrus-based flavonoids. Diosmin is the main ingredient, which is derived from the white part of a sweet orange. Diosmin has been well researched as a citrus-based flavonoid. It has been used for decades to support healthy capillary and vein function, as well as healthy microcirculation throughout the body. Diosmin has been studied by doctors in Europe for more than 30 years. The long-term safety and benefits have been studied in humans. One 2-year study in 2002 included more than 5,000 subjects and was conducted in clinics in 23 countries. Some of the studies were double-blind, placebo-controlled, and my recent PubMed search on Diosmin displayed 391 references. The most promising research results come from a micronized purified flavonoid fraction comprising 450 milligrams of Diosmin and 50 milligrams of hesperidin, which is a precursor to Diosmin. The process of micronization, reducing the particle size to less than 2 micrometers in diameter, improves Diosmin absorption. It appears to support vein health by prolonging the normal effect that the catecholamine norepinephrine has on the vessel wall. Ultimately, micronized purified flavonoid fraction supports antioxidant systems and eicosanoid balance. Truly, DioVasc can help in most people in several ways. Improved venous return and capillary fill improves health of our tissues throughout our bodies. Additionally, I would recommend it for most people that are experiencing painful varicosities, painful hemorrhoids, and those who do not like to see spider veins. I tell my patients to take 1 capsule twice a day without regard to any other foods or supplements. Well, of course, everyone's response is different, and the specific nature of the sport I'm aiming for makes a difference in the time it takes to respond. However, in general, patients may see a difference in as little as 2 hours after a dose, and in one study I've read, users reported a positive response after a single dose. Each patient is different and may require modifications that can include supplements. In my patient population, where DioVasc is part of their overall health regimen, I am seeing that some who use it as a maintenance nutritional supplement have less spider veins and varicose veins. And in a few of the more severe cases, some are having far less venous stasis ulcers. The process of micronization, reducing particle size to less than 2 micrometers in diameter, improves the diosmin absorption. related, the cost of a single bottle, which contains a month's supply at 2 caps a day, is significantly less than dinner for 2 at a chain restaurant. DioVasc supports veins, capillaries, and circulation, helps promote normal lymphatic drainage, supports antioxidant activity, supports blood glucose metabolism, and supports healthy eicosanoid metabolism.